Board. Alrighty, so I want to make my screen a little wider. Welcome everyone to the Minnesota Community Health Worker, commonly called MNCHWA Learning Circle. The Learning Circle is a peer learning circle which meets the first Wednesday of each month from 3 to 4:30 p.m. remotely. It's open to all CHW supporters and allies, and it's provided to us by the Alliance. The mission of the CHW Learning Circle is to provide an avenue for CHWs to connect, learn, and tap into one another's knowledge through discussion. The MNCHWA Learning Circle is hosted by the Minnesota CHW Alliance, which lays out a platform of clear organizational goals and objectives for the advancement of all those in the CHW profession. The vision of the CHW Learning Circle is to create a workforce that encompasses the voice of those in the CHW profession and supports our vision of nothing about us without us. The CHW, I'm sorry, I'm doing double duty letting everyone in. The CHW Learning Circle is a monthly capacity building event for CHWs. It's facilitated by CHWs, and at the circle, CHWs like myself learn with their peers and explore issues in our field. The circle provides an environment in which CHWs can share successes and concerns and gain their perspective through peer-to-peer relationships. CHWs work in multiple work environments and enjoy getting together and learning with each other, and how our work in each other's work in different settings. We have guest speakers to provide training from their expertise or about current issues in the healthcare or workforce field. The guiding principles that the CHW Learning Circle supports our vision, which is nothing about us without us. My name is Angela Fields, and I am the Associate Director of the Minnesota Community Health Worker Alliance. I'm a CHW certificate holder since 2008. I manage and facilitate the Minnesota CHW peer-to-peer learning circle activities. Our objectives for the learning circle. We understand that each organization faces unique challenges, which is why our discussion sessions focus on our core needs that all CHWs need to be successful in our role. We explore strategies to increase the effectiveness of CHWs. We provide knowledge around the impact of health, and we examine the ethical concerns inherited in our CHW role. The circle content can cover a vast variety of topics, such as our scope of practice and the various roles CHWs can play in an organization or on a team. We talk about core professional skills and the CHW character developments, also offering professional development training. We talk about workforce development and engagement options for CHWs. We talk about health trends and health topics, and even those that could affect us. We talk about health education, health technology for various populations that we serve. I welcome you to the Minnesota Community Health Workers Wednesday, April 3rd Learning Circle. Today, our Learning Circle will feature the 8 healthy home principles. And we'll talk about the important information about the 8 healthy home principles. Keep it dry, keep it clean, keep it pest-free, keep it ventilated, keep it safe, keep it contaminant-free, keep it maintained, and keep it thermally controlled. We'll learn to understand the connections between the health and housing and how to take a holistic approach to identify and resolve problems which threatens the health and well-being of our residents. Our presentation will be presented today by Rochelle M. Palaska. She holds a MPH, and she's from Sustainable Resource Center, the Home Performance Solution. Rochelle has been with the Sustainable Resource Center since 2008 as the Director of Health Education and Outreach Programs. She is responsible for the management of the lead poisoning prevention and training program. This includes community-based screening events, in-home visits, referrals for lead hazard control services, and training for lead in healthy homes. Rochelle has been a training partner through the National Healthy Homes Training Center since 2009. Rochelle also works for the American Red Cross Twin Cities chapter. Rochelle graduated from the University of Minnesota and her master's in international public health from the University of Tulane in New Orleans. And we will provide all of Michelle's contact information as we transpire through this presentation. And I will turn this portion of our learning circle over to our presenter, Michelle.
Hello, hello. Thank you. Thanks so much. It's very exciting to be here. Thanks, Angela, for inviting me to present to you. And happy National Public Health Week. So to everyone in public health and doing the good work and helping health, promoting health, I commend you all. We honor you, not just this week, but throughout the year. It should be celebrated because we do great things. So today I'm going to be talking a little bit about healthy home principles and focusing more specifically on lead poisoning prevention, because that's really what my job is day in, day out here. Healthy home principles is all encompassing. There's 8 principles, and it usually takes a lot longer than 45 minutes. So, and without having to rush through it, I'll go through the basis of it or a brief explanation of it all, and then I'll get into the nitty-gritty of lead poisoning prevention. All right. So here we go. Just a background about who we are, what we do. We're a nonprofit organization. Our mission is to create healthy and safe and energy efficient home environments. We started in 1977. We currently have under 30 employees. Our big strength is that we conduct residential assessments. So we're in people's homes. We're doing interventions. We're being the first line of defense with education, outreach. We also do trainings. And our primary territory is Hennepin County. So we have 2 main departments. One is our weatherization department, and we are the largest, energy service, Department of Energy weatherization program in Minnesota. We're one of them. We also, we assist programs through CenterPoint and Energy Excel. And we help families do the whole house approach. So if we go to the homes, if somebody needs air sealing, if they need insulation, if they need a furnace or water heater replacement, we do that. We also have a program where families can get home energy savings and exchange an old refrigerator that takes up so much energy with a brand new refrigerator or air conditioner and things like that. I'm specifically in the lead testing and remediation department, and I also run the lead education outreach screening department. So what we do is we work with Hennepin County and to administer the HUD lead grants. Okay, and this is really to protect children in Hennepin County with to protect them from lead hazards. After they're enrolled into the grant programs, then a licensed risk assessor conducts the full risk assessment, or it's called PIRA, and in order to make the home environment safe. And we primarily deal with lead painted windows, the high friction surfaces in pre-1978 homes. We act as a support system. We get referrals from all over. We work with nonprofit organizations. We work with clinics, medical providers, City, Minneapolis, Hennepin County, and MDH. We receive referrals and we offer free in-home visits to conduct education. And then also we do samples and identify if there's lead hazards there. So we do a lot of testing events out in the community. You can see Letty Eddy there. And we have a mobile van, which is a Letty Eddy van. It looks like an ice cream truck. So a lot of kids come up to us thinking we're going to be passing out ice creams, but it's, unfortunately we have to say, no, would you like a lead test? So we offer free capillary finger pokes, okay, lead test. And we use a blood analyzer, a lead care 2 machine, and we get the results within 3 minutes. And so that's huge. Parents come and get resources, and you can see our little mascot there. So we try to make it fun for community outreach events. So if you have any events this summer, please keep us posted. Yeah, we'd love to come out and do it, help out. So our whole philosophy at Sustainable Resources Center, or SRC, our philosophy is the house is a system. Okay, so we take a holistic approach to this. We want to identify the energy performance, the weatherization side of things. We want to talk about the safety hazards. You know, how can we avoid hazards in the home, and what is the health impact? So we recognize that health and safety in the home and the building performance of the home, they're all interrelated. So we want to address the people that live in the home, the structure of the home, and what are the potential health hazards, so that we can fix everything, okay, and help make it a better home environment for the families. All right. So the role of housing as a contributor to health is nothing new, right? We've known it for decades. And this is a quote from Florence Nightingale in the 1800s. She mentioned that the connection between health and the dwelling of the population is one of the most important that exists. So this connection of health and home is super important. Florence Nightingale, as we all know her as, she is the pioneer of modern medicine, really, or modern nursing. And she did a significant amount of work in the slums and in the hospitals. In fact, she improved the hospital rates, hospital conditions, and decreased the death rate from 42% to 2%. By doing the following. She addressed overcrowding situations. She improved sanitation. She was able to address the lack of ventilation. And then also talk about, she was able to affect defective sewers and plumbing. So all of this, you know, improving these systems in those hospitals significantly led to a decrease of death in those hospitals. So that's a great example. So the definition of a healthy housing, okay? Healthy housing is designed, constructed, maintained, and rehabilitated in a manner that is conducive to the occupant health. So it's only as good as the outcome for the family, okay? Again, this is the approach that we're trying to take, a holistic approach that deals with the people living in the home, the structure of the home, and addressing whatever the hazards would be in the home. And so why do we care? All right. We know that there's a lot of research that has been done, and that is linked to indoor air quality and indoor pollution, air pollution. And it has an effect on acute and chronic disease. So we know it can affect it directly and indirectly, physical, chemical, biological exposures. You know, we've got asthma, cancer, that is from asbestos or radon. We have rats and pests issues, and perhaps the poisons that are used to get them out of the home. And then we have poisoning such as lead poisoning and carbon monoxide poisoning. But there's also psychological health effects that perhaps are caused by hoarding issues or overcrowding or bed bugs that can be so detrimental to someone's psychological health as well. And the most important thing is that children and families are spending so much time in their home. So this is, you probably have seen the statistics about children spending a lot of time in their home, and thereby getting more and more of these acute or chronic diseases from the effects that are happening, the health effects. So here's a significant list of health conditions that are related to housing. So we have asthma, which is caused by a combination of items: dust mites, pet dander, roaches, mice, tobacco smoke, and mold. Okay, brain damage can be caused by lead poisoning. We'll talk a lot about that as lead poisoning is a neurotoxin, so it's affecting the brain. And lead poisoning also affects behavior and learning problems. Tobacco smoke and radon, those have significant impacts on somebody's lungs and lung cancer, that could lead to lung cancer. Other home-related illnesses or items could be sharp edges, a lot of garbage perhaps, or a lot of stuff, basically trash boxes, so somebody could get injured. Childproofing is a good strategy in order to avoid that. But if you don't have childproofing items, then it could lead to an injury. And then stairs that perhaps don't have railings on them. So again, there's this whole correlation between the health conditions, health conditions and housing conditions. And then the poisoning, as I mentioned before, lead-based paint, carbon monoxide, perhaps other chemicals and pesticides that are out there as well that are stored in the home that could lead to a poisoning of the child. So, a 7, instead of, it's 8 healthy homes principles, and they are all clearly listed here. Keeping the home dry, keeping it clean, keeping it ventilated, pest-free, keeping the home safe, contaminant-free, maintained, and then thermally controlled. So we want to make sure that, it reduces the risk of extreme heat or extreme cold in the home. So those are the 8 healthy home principles. If we were taking a full class, which I'm going to show you a flyer later, this is like a full day course. And then to really get into the nitty gritty of each one of these topics, we do offer a 2-day course. At this time, however, I really want to get into more of keeping the home safe, keeping it maintained, keeping it contaminant-free. We're going to talk a little bit more about lead poisoning. And this might be something that you may be familiar with, but this is a clear picture of this sort of chipping, peeling paint in a very old home. We drive by North, South Minneapolis, and I could identify right away without even knowing the address of the home. Oh, that's lead-based paint. And that has this characteristic feel for it, and the visual of like imagine a crocodile skin or alligator skin, that chipping and peeling paint. All right. So what is lead? Lead is naturally occurring. It's a heavy metal. It's used in just so many different items. And for example, plumbing and the pipes, ammunition and bullets, glass, leaded glass, crystal. So these are some examples of items that have been used with lead in the manufacturing of these items. Okay. The reason why it was used is because it holds its color well, it's very malleable, and it's cheap. And so what you can do is you mix it up with different things. It combines with other elements and produces other types of things, other products. Lead has no use in the human body, so it's really not supposed to be in our body. And all forms of lead are toxic to people and animals. And it's a neurotoxin, as I mentioned, meaning toxin is a poison, and neuro meaning it affects the central nervous system. Below, you'll see 3 different pictures. These are just different types of lead being combined to other elements. And you have lead oxide as an orange powder, lead carbonate. It's more of like white crystals. And then we have the odorless liquid of tetraethyl lead. And that was used predominantly in gasoline. So I love the history of lead, and it's just goes way back. I think that even, well, it was first diagnosed by a doctor in Australia in 1895. And the US starts admitting it, that it is a poison. The National Lead Company admits that it's lead poison in the 20s, 1921. During the 1930s, lead-based paint is really banned throughout much of Europe. But unfortunately, it took the US a lot longer to finally do something about it. And they finally banned lead-based paint in 1978 for residential use. We still are using, companies are still using lead-based paint for industrial use. So the yellow lines on the street, the big water towers that you'll see, the bridges, all of those, because they're malleable, it's the paint is brighter, it has advantages, and hopefully there's no children there. It's not residential use, but they are still using it for industrial. And then in 1996, lead as an additive on the road for gasoline, it was finally banned. However, they still are using it for some other like flue air gasoline for some of the airplanes. So this is right here, advertisement, a Dutch boy, white lead. They used to put it everywhere. They used to put lead-based paint in hospitals because it had another positive property that it killed, it was resistant to mold and mildew. So this is a picture, 1979 or 1937, National Lead Company having an advertising in the hospital. And the logo is, it takes a scrubbing, so it's really very durable, right? In this graph here, you'll see tetraethyl lead was added to gasoline, and the reason is because to prevent engine knocking. And that was something that started in the 1920s. It started phasing out in the 70s. And so you can see a picture in the red, you'll see the graph showing the total lead used in gasoline, okay? And then the black line, which is actually paralleling the red line, is the average blood lead levels. Okay, so right away you see this correlation where as soon as lead in gasoline started be phasing out and going and declining, the blood lead levels in children started to also decline. So it was a good thing that that was being addressed and being banned. The other place where we really see lead-based paint being used is in homes. And the older the home, the higher the risk that, that lead-based paint was being used. So homes that were built before 1940s, you'll have a much higher percentage of lead-based paint, and thereby increasing the risk for children getting lead poisoned. I think your homework for tonight, everybody should know the year that their home was built. So if it was built before 1940s and you know that you see some chipping and peeling paint, definitely give me a call and we'll have a one-on-one conversation. If your home was built after 1978, then you're pretty much clear on the lead-based paint side. However, there are some other risks that we might, that also other substances that contain lead. All right. So the fact is that lead is still around us. You know, Minneapolis, 80% of their homes were built in before 1978. So we have these red pockets, you know, these hot zones in North and South Minneapolis. And we still have the soil contamination from that gasoline that was so prominent back then, and it was later on phased out, but it's still being industrial use. We have got companies that have emissions out there, and the dust the dust that's created from that. And then every time that we open and close the windows, you know, the chipping paint, the dust from exterior renovations and scraping, that's all being caused. And it's still very much with us today. Here we have some other pictures. Housing is a big source of this lead exposure. It's in the walls and it's in exterior, it's in the stairs, the doors, and the windows. So again, home renovations, people doing home renovations can disturb this old base paint, the old paint, and it's invisible. So lead dust is also just invisible to the eye, and it spreads. Here's pictures of an older home. Like I said, you all can see that this is an older home, lots of chipping and peeling. These homes right here with these pulleys, there's a little drawstring on the side, on the window jamb side. That's a clear sign that it is an original window, and it's an older window. So there are three main populations who are at risk for lead poisoning. The first and most important, first one is the children under 6, and they're the most vulnerable. Their brains and bodies are still developing. They're closer to the floor, crawling around, getting up. Everything is, lead is a heavy metal, so it's on the floor, gets down. And they have this natural hand-to-mouth behavior. So they're absorbing a lot more all nutrients, they're absorbing everything at a higher percentage than adults do. And so that's why they're the most vulnerable. Pregnant women also are the second high risk population. They can store lead in their bones for a very long time. They could be previously exposed when they were little girls, and then as they get older and then they become pregnant, their body uses things that are stored in their bones, and it's can be leached out into their bloodstream, thereby affecting the child and the baby. And that could have huge risks for undeveloped fetal growth, risks of hypertension and preeclampsia. It could a higher risk of premature delivery and low birth baby, and even higher risks of spontaneous abortion. So also pregnant women have this tendency, they perhaps could have pica, and that's just the urge to eat non-food items, perhaps like soil, ceramics, or paint even. And the third occupational, or the third group that's high risk for lead poisoning are occupational exposures. So if you have a person working with renovation projects, or painters that have to scrape a lot of things, factory workers making batteries or bullets, or auto maintenance and mechanics. So those are all some examples of occupational exposures. And lead enters the body you can ingest it, you can inhale it, or can be a dermal kind of entering of the body, absorption. So here's a little picture entering the system. Once it gets in the body, goes through the bloodstream, is affecting the brain, could be stored into the bones and last there for many, many years. And then the kidneys are our filter organ, and it can really have severe consequences on the kidneys as well. And the fetus is, as I mentioned, affected as well for a pregnant woman. So here we have some examples of lead sources. We already talked about the windows being a big lead source, especially in homes that are built before 1978. We've heard of what happened in Flint, Michigan, certain water pipes that are contaminated. Luckily here in the US, in Minnesota, we have not had any child getting lead poison through our water pipes. And MDH is working on prevention methods for that too. But lead can also be found in toys and jewelry, and sometimes candies, and imported makeup and home remedies, medicines, and then, as I mentioned, other certain jobs, but also hobbies. So we have some pictures about some of that later on too. I'll describe it more. So again, the messages that I just want to reiterate is that lead poisoning, the higher the risks are, that the older the home that was built. We see a lot of more children or families from low-income families living in these older rentals and older homes that aren't getting maintained, aren't getting windows replacements, or the remediation for lead. We're seeing a lot of migrant, refugee families also bringing in imported spices and medicines that have been contaminated with lead. There are certain laws, but it doesn't always get noticed or enforced. And then oftentimes these newly arrived families, they're resettling into older homes because that might be the cheaper option, and they might be at risk for lead hazards there. The other high risk is, especially now, doesn't feel like summer, but we are starting to get into the summer months. Summer months tend to have higher blood lead levels. People are opening up their windows. Again, this high friction surfaces that's creating lead dust. Home renovations are more common in the summertime, the porches, the stairs, all of that. And the children, of course, are playing outside on the porches or the soil that is contaminated with lead. Here's some pictures of items that may contain lead. Here's a Kohl makeup, eye makeup, Coke remedies, and then this these ceramic. Oh, let me just show you one thing. Okay, so I was in an in-home visit a couple months ago, and this woman had beautiful cups, all right? So these are gorgeous Mexican pottery, and I talked about, oh, lead could be in the glaze, it could be in the pots and the soil. And she said, no, this one doesn't have any lead. I don't know if you can see that, but it says made in Puebla, lead-free, okay? So that's really interesting. Okay, wonderful. And this one doesn't say anything, but guess what? I said, well, let me borrow both of these and I'll come back with them if they were free. And but anyway, she actually, both of them came back very high. This one is 2.5 milligrams, the one that said lead free, and this is 2.3 milligrams per centimeter square. And so items like this that I see in people's homes, and there was, she was drinking a cup of coffee out of it. And so we see these items all the time in people's homes. So a lot of education. And then these are some other sources, and you might even be looking through these sources, these items and saying, oh my gosh, I use that, or, oh, my kids love this, this type of candy. We had an intern create this for us, so we're very grateful for our intern that created this wonderful flyer here. And so a lot of different products that are imported that perhaps don't have the same enforcement in, the same rules and regulations about lead in their own countries. So what are the health effects of lead poisoning? We mentioned it's not natural to the body, and there is no lead safe limit. So we all should have 0, but it's in our world. So unfortunately, we have to deal with that. Back in 2012, CDC revised the definition of childhood lead poisoning. Used to be a 10, and now it's a venous blood lead level of 5 and above. So 5 are equal to or micrograms per deciliter or above. And so that means when we're doing our lead testing events and we have a capillary test results of my 5 micrograms per deciliter or above, then we get the family, we talk to them, and we do immediate kind of follow-up so that they can get a venous test. The health effects is that it's irreversible loss of IQ, impaired growth and hearing. A lot of times a child with lead poisoning will have attention deficits and ADHD. Increased likelihood of dropping out, delinquency, and incarceration as well. So a lot of serious health effects. It is a neurological effects, renal, cardiovascular, reproductive, especially for adults, and developmental for the children. So here we see a visual. Okay, this is a picture of a test that was done on the effects of lead and their visual memory. So the study, an experiment of a test was given to children and asked to study. So they studied for a couple minutes this complex figure, okay, you've seen over there, very detailed, and they were to study it for a couple minutes. And then they were told, their picture was removed, and they were given a blank sheet of paper, and they said, all right, now can you reproduce it without seeing it again? And they tried to reproduce it. And you can definitely see that the child with lead poisoning retained very little of those details compared to a child with non-lead exposure. So that visual memory is not there. So not only does it have an impact on the child himself, but it also impacts a wide variety of things in the cost, education, health costs, and so all of this medical and special education costs can really be impacted in the family and take a big toll on their budget. And then it has ripple effects as well. So, you know, hyperactivity, speech disorders, lower IQ, learning disabilities, and then what is the cost to the child's future? Well, perhaps a criminal record, or, you know, academic failure, learning difficulties, trying to get a job might be difficult. So lifelong health problems, and the cost to society, you know, unfortunately, you know, it does have cost to society too, because we have to invest a lot into special education and the juvenile justice and healthcare and all of that. So this sort of gives you, it's not just about the child, but it does have other implications overall. So symptoms of lead exposure, a lot of times a child with very low lead levels will not show any symptoms, okay? And they could be very, very low symptoms and still be affecting the organs and still being poisoning the child. So here's a little picture that talks about the low levels, then medium levels, and then even to extreme above, higher than 100 micrograms per deciliter could cause serious, you know, unconsciousness, coma, and death. And easily misdiagnosed because there are no symptoms very early on. There are no symptoms. Chelation is sort of controversial. The different people have different philosophies about when to apply it. Most often when children are at 45 micrograms per deciliter or above, that's the start time when people start talking about it. It is very, very painful. It decreases the body burden of lead, so it removes all of the heavy metals, including iron and mercury and arsenic. It removes all of that, including the lead. However, it is very, very painful, and it does not reverse the damage and the neurodevelopmental effects that have already been caused. That's why prevention is so important. So we do follow the Minnesota Childhood Blood Lead Screening Guidelines, and you can all go online and take a look at them. Some of the most important things that I want to point out here specifically is that all children who are between 1 and 17 years old age can get a lead test. That's part of the childhood guidelines in Minnesota. And it's highly recommended that at age 12 months and 24 months that all children receive the testing. And if it is higher than 5 micrograms per deciliter, then a confirmatory venous test is needed immediately. So here we have a picture of our Leady Eddy van. We have the Lead Care 2 machine that we use to get results in 3 minutes. And then the nurse that is hired at every one of these events to do a finger poke, a capillary finger poke, and we analyze the blood right there inside of the van. We do lead testing throughout the year, so we don't necessarily need the van. The van goes into storage, but if you're having an indoor event, please invite us, and we can certainly offer free lead testing indoors as well. And so I want to leave on a positive note. What can we do to keep our children lead safe, right? Everybody should do a visual inspection of their home. What kind of windows do they have? What year the home was built? Keep it lead safe cleaning. Basically, it just means that if you do see chipping and peeling paint in the window wells and it's summertime, you're going to be opening up, make sure that you're cleaning up. This woman up there in that picture showing a 2-bucket cleaning system kit, one with sort of soap and warm water, soapy water, and then the other one is a sort of clear water, clean water, and just to wash it out. Washing toys frequently if something falls on the floor, regular hand washing, leaving shoes at the door also greatly avoids all of that soil and dirt and perhaps lead from the dirt to enter the home. And then always nutrition is very very important. Foods that are rich in calcium and iron and vitamin C can greatly reduce the lead levels in your blood. So it actually helps bind to that lead and eliminates it. And then if you do have any chipping and peeling paint, make sure the children, everybody stays away from that, from those painting, the chips. And we do offer a class. It's called Lead Safe Work Practices class. If anybody is interested, it's a 2-hour class. If you're going to be doing small renovations, everybody who is enrolled into our grant program has to take it. And there's grants to take this that allow people to take this class. And basically working wet is that instead of dry dusting, you're working wet, all right? You're spraying something and then with a cloth wiping over it. The point is to get rid of all the dust, any dust that's created. HEPA vacuum is HEPA stands for high efficiency particulate air, and that has basically 3 filters. And HEPA mask if needed. It just depends on how much dust you're creating. And then protecting yourself as well with protective clothing. As you see this worker right there, the painter has an air mask, a hat to protect them from the hair, from lead dust, and protective gear that they can just put into the washer. And then when in doubt, call a lead professional. That's the key there. So this talks a little bit about our window grant replacement program. We do offer free in-home visits to identify lead hazards, and we can do a quick, takes about 40 minutes, 45 minutes to an hour. We identify all the lead hazards. We can also assist families into getting into the grant programs through City Minneapolis or from Hennepin County. And it is available to tenants, renters, and landlords and homeowners. So it is available to everyone. And what we would just do, we have a pre-qualifying questions to see if you qualify for a home visit. The requirements basically are, we would ask you when your home was built, if it was built before 1978. Typically, we can take a look at some pictures on the internet to see if it has old windows or if the windows have been replaced. There does have to be a child under 6 years old that's visiting or that's living there or frequently visiting. Or if a pregnant woman is living in the home as well, we can address that. The grant for Hennepin County, families have to live in Hennepin County, and there's another grant in City Minneapolis, and the families need to live in City Minneapolis, and then meet the low income guidelines. We do have a referral form, and I could send that to Angela as well, and she can forward that all to you. If you are working in agencies that perhaps would like a referral form, and we can work together. You can send us referrals, and we can learn about your program as well, and we can send you referrals as well for your programs and your resources that you may offer our very similar families. So this is, I know there's a lot of information here, but there's 2 main boxes, the sort of divide the page. On on the left side, you'll see training dates. This is all healthy home trainings. I was not able to get into it for a lot because it takes more than just 45 minutes of a presentation. But May 9th, we're going to have a virtual 1-day Healthy Homes 101. Okay, so that's 9 to 4:30 on May 9th, and it costs $20, and the registration fee is, or registration process is right there. Go ahead and I'll also send this flyer to Angela, who can maybe forward it to you via email, so then you can just click online and get it registered. You could either come by and pick up the materials from me, or if you live in Duluth, and then I can mail it to you. Okay, so that's totally fine. That is a wonderful class. We're going to talk a lot about the 8, not 7 healthy home principles, and the relationship about it, and we're going to get into each one of those principles. If you really want to get even more into the principles and solutions and all of that, that your job really requires you to do healthy homes and in a more in-depth, comprehensive view, we do have a 2-day Healthy Homes course, and that is called the Essentials for Healthy Homes, and that is $40 only, to attend. That is an in-person 2-day training, and I highly suggest taking one or both of them. It's not necessary to take both, but I just suggest you taking at least one of them. We are working in collaboration with MDH, and that's why the cost is so low. Typically, these courses are over $100. So I would highly suggest, while the funding is still available, to please sign up and register for one of those. Or both of those classes, and share it with your community. And lastly, one more thing, I just wanted to share with you that we are looking for summer help. We have summer internships that are available, flexible hours. You're really going to get some good hands-on experience and really make a difference. Working in this community is fun, and we play an important role to fight against lead poisoning. So an internship would be someone who is outgoing, helping us with attending the community events out there in the community, talking to families, helping us with lead testing part of things, and then also going on in-home visits. You would not be by yourself, but we would help you go in and do you could help us out with all of the in-home visits and education to the families. So I'll give all this information to Angela. This is my last slide. It's basically my information. Write down my phone number, my email, and any other questions. I can talk to you directly, or I can answer some questions now too. Thank you.
Thank you, Rochelle. Thank you so much for this informative discussion about the 8 healthy home principles and keeping CHWs at the forefront of the conversation. Can you talk a little bit about the current work of CHWs with resource Sustainable Resource Center? And
Yes, well, yeah, we've had the while ago, we had some internships available. We always have internships available for community health workers, and we've been a site to host several different community health workers to receive their degree in helping them identify what we do at a nonprofit organization. And it is very unique. We even hired community health worker. So we do have job postings often available, and I make sure to send out the job description to the Minnesota Community Health Worker Alliance, and I send that out. So we do have a good relationship, and I encourage community health workers, even if it's for an informational interview, information about what we do, we can certainly do that. It's a unique agency because we go into people's homes. It's not just office work, and we're out in the community doing events. So yeah.
absolutely. Thank you for that. And I see that Peter is here, and I know he has some experience with your organization. Peter, would
Yeah.
you like to add to this discussion?
Oh,
Share your
sure.
experience?
Um, let's
Can you
see.
introduce
Well,
Yep.
yourself and your role?
Peter was hired as one of our community health educators. And so, yes, he went out to people's homes and talked to families to get and do lead testing to see if they had lead hazards in their home, and was a real advocate for us. And he always found events for us to do lead testing. I don't know, Peter, you can talk more about
About your experience.
your experience.
yeah, well, we did a lot of community events, particularly in Minneapolis, but just offering free lead testing.
Mhm.
I don't know if they still have it, but in the past, long story, but we were able to give people a $50 gift certificate if they lived in north or northeast of Minneapolis, if their children get lead tested. And if you have a lot of kids, you can get a
Yeah.
lot of gift certificates.
Yeah.
That's because of a court case. But
And yeah, they still do that, Peter. City of Minneapolis, when they're hosting events in specific areas of North and South Minneapolis, they will have that as an incentive. Um, you know, families don't want to get their kids tested. You're at an event, at a health fair or something, and you're like, oh, we don't want the kid to be crying, but it is a great incentive. And they
yeah,
still do it.
and even I mean, it's a quick fingerprint prick.
Yeah.
And so most kids either don't cry or they get
Yeah.
over it fairly quickly. We would give them a sucker or something
Yeah.
that helped. But it's really amazing how much of Minneapolis and some of the older suburbs, Brooklyn Center, Brooklyn Park. I mean, it's like every house has lead.
Yeah.
No, um,
Yeah.
if for some reason the houses would have the windows replaced, I mean, that's, the worst source. But I was shocked how well, I think it's in Michelle's presentation, she was saying 80% of the houses
Mhm.
in Minneapolis were built before 1978.
Yeah.
Um, and particularly, well, in any house really, but um, a lot of rental properties because the being honest, the landlord hasn't put in the money or the time to get rid of lead paint. And then,
Mhm.
um,
Right.
if a landlord, I mean, it's a deal for a landlord.
It,
Is
I don't,
something like that
it,
very expensive though? Is
well,
it
that's
yeah.
what I was
considered
just
that
going to say.
expensive?
It's mostly covered. They have
Yes.
to pay a certain percentage. It was
So
10%, I think,
Yeah,
20%.
exactly, Peter. Yeah. So it used to be 50-50. The grant would cover 50% of the cost, and the landlord would have to invest 50% of the cost. Now, the grant covers like 90% of the cost, and the landlord only has to cover 10%. I mean, it's a win-win situation.
Involved.
All landlords should be like running towards this program because it will only increase the value of their home and help their tenants be safe. Yeah.
Right,
Absolutely.
right. I mean, it's expensive to replace
Yep.
windows. So if you can get it mostly paid for,
Yep.
like
And for
Michelle
rental
was,
units, I do have to say, there does not have to be children living in the home. Okay, so
Okay.
that's a caveat there because it is a rental unit. Landlords can, oftentimes they may have families with children living in there, but then if they move out, so for rental units, you do not need to have children under 6 years old that are living or frequently visiting.
Well, that's definitely good to know. And I'm going to get to the questions and responses in the chat in just a moment. I just started scribbling down so many questions and things like that. And one of the things I'm just really inquisitive about is um as a CHW in that environmental space, were you a part of like safety and environmental audits or informal walkthroughs for general safety and compliance issues? Like for CHWs are home visitors, so they're out in the community and they're out in organization, they're out in various things like that. So without that intentional training or that intentional awareness, I'm just thinking, what are the things that we could potentially learn about how to identify those things in that environmental health space?
Oh, that's a great question. And yes, and the work that community health workers do, and anybody going into people's homes, there are some really key things that you should know and practice before going to people's homes. Number one, always have we have a pre phone, we take a phone call. So we do an in-home intake checklist where we ask all our questions. What door do you want us to enter? Do you have a back door, preference door, or the front door? Do you have pets? Are there any other items like other healthy home items like bed bugs, roaches, rats, anything else that you would like us to address? So we try to get all of the information right away on this checklist. And that gives us a better picture of what we're getting into. Okay, we know how many people are living in the home, how many adults, how many children, and what's their income. So we have this whole list. Again, that also serves as a purpose of building that trust. You've had a conversation with the family, they know you by name, and you're going through all these questions, and you're establishing this trust and communication. Then when you go to the person's home, so then you have a better idea what to expect and maybe what to bring. Hey, perhaps they have bed bugs, and that would be right away. How do you protect yourself from getting bed bugs? So we do go through some type of trainings. We go through this whole intake checklist and how to build that trust with the family. We call them before, hey, I'm on my way, like that kind of thing. And we let them know what they are going to need on their end to have prepared for us as well. So, but yes, it's knowing what you're getting into, calling, building that trust, and then also how to protect yourself before going into their home.
Okay, so CHWs kind of bring that cultural bridge to address those environmental public health issues and through the partnerships and the development. So I can see them on every spectrum from the intervention, assessment, intervention,
Yes,
cultural bridge, services, resources, connecting. I got it. So
absolutely.
let's switch to our I think this is the first question of the day. Pardon me, I'm just scrolling through. I have a question regarding, is this grant only available in Hennepin County? Is there any kind of grants for outstate Minnesota?
So that's a great question. MDH did get, or MDH is the whole umbrella, right? So this is a big one that we have, the Hennepin County, City Minneapolis has, and Ramsey County. Okay, so that has a lot. Some of the other big cities, Duluth they have their own lead grant program as well. MDH has a list of grantees, and I don't have that list necessarily with me. But I would suggest that if they wanted to get, I think Roxanne, if you wanted to get a list to see if your city or town, is on that list, to contact somebody at MDH or go on their website or call me, and I could, contact me via email, and then I could get that list for you as well. But to the extent of what Ramsey County, Hennepin County, this is where you find it the most. But I know Duluth has a lot of older homes there, so they do have a lead grant program there as well. And I don't know about some of the other counties that may or may not have lead or healthy homes grants, but I know they're trying to get more exposed. The other thing is that any child that's tested 5 and above, with a venous test of 5 and above, will get immediate kind of help from MDH. So there will be a risk assessor. There will be people involved in getting families the help that they need. But that is only sparked if there's a child that's been poisoned. Okay.
So those, so how I want to articulate this. So you mentioned that children are being tested. Are those standardized blood tests that they get at their primary, or is an intentional blood testing in, say, for instance, I know at once upon a time, I've been out of that area
Yeah.
of service. The WIC office used to do mandatory testing in increments. So how are children randomly tested, so to speak?
Right. That's great. So MDH requires, so the Minnesota bloodline guidelines requires all children at 12 months and 24 months. And they can they can get tested up to 17 years old. Okay. However, predominantly it's 12 months and 24 months, because that's the greatest risk. You know, they're crawling around, they're putting things in their mouth, they're toddlers. So that's the highest risk of lead sort of absorption and everything and exposure. The testing at WIC is also really, really important, and WIC does their own testing as well. We offer free lead testing out in the community and throughout the whole state of Minnesota. An example of this, we're working right now with Wright County. Wright County, they don't have a lead program, but they've asked us to come out and do lead testing to several of their Head Start groups. So they're coordinating everything for us, and we're basically driving there from like 8 a.m. to 3 p.m. and we're going to hit all of their Head Start groups that the children should have gotten a lead test, but they are not getting it. They haven't gotten it, and they need it for their purposes. And so we're funded by MDH, so we can do those kind of testings, a free testing, and get the results right away to them. So
That's
we'll work
awesome.
with other counties and other Head Start groups and, to get testing.
That's awesome. Some actual boots on the ground, frontline work is being done.
Absolutely. Yes.
Um,
Yes.
Another question in the chat box. Can you show the slide with the spices and products again?
Sure. Okay. And I can send you this as well. So I've got my notes here. I'm going to send you a variety of different things, Angela, and then with follow-up email with all of these attachments. And then if you could please share it via email with all of your participants, that would be wonderful.
I
Yeah.
will do, and those will, all of the meeting content today will be shared in our meeting minutes as our post-meeting
That's
activity.
page 1 and this is page 2, right?
Our next comment was, thank you, Rochelle. And then we have another comment, a question, is the grant called Healthy Homes?
Yes, let's see. Healthy Homes, I believe it is a mini grant that you're referring to, that people can get, and that would not necessarily include, it wouldn't include, let's say, a home visit for lead hazard control, or it wouldn't include the window replacement that we have. But it is a great resource for, CO detectors or fire extinguishers or, child proofing. So you would definitely want to look into what that grant in that specific county offers, because they could be a recipient of the Healthy Homes grant, but every county might do something a little bit different.
Alrighty.
Good question. Yeah.
And I don't see any more questions in the chat. If there's any more questions amongst our participants, please unmic yourself and ask your question, or throw your question in the chat.
And I'll put it right. Oops, there. No.
And Rochelle will bring back up, yep, our PowerPoint. So therefore, you'll have our contact information on the screen. I just had another curious question as we bring this discussion to a close. Just recently, I'm a St. Paul resident, and just recently, there's been a lot of awareness around the St. Paul lead-free 10-year plan to replace all lead water service lines. And so homeowners and commercial business owners can sign up for the services for free. So over the next 10 years, they will be replacing our water lines. So what is our risk? Should I get tested for lead? Or I don't have anyone currently in my home under the age of 10.
Mhm.
But how is, I've raised children here, so I'm kind of wondering that effects of lead in the water system. So is it a double exposure, the water system and the home structure?
So,
How you get poisoned?
yeah, and I don't know exactly what Ramsey County, how they're gonna, what the plan is, but predominantly the water that goes into your home, the pipes are okay, and most often, okay? You're not seeing sort of, unless you have very corrosive pipes, okay, and the faucets or attachment and everything. I would suggest if you're concerned about water and, lead in water, using a filter. Filter your water. They often sell these very, reasonably priced filtered water,
They connected us
containers.
with
Yeah.
resources.
Yep.
It
And then
wasn't child
also
actually.
especially in older homes, you would want to make sure that in the morning, before getting water out of it, let the water, put it on cold, not hot, because hot absorbs, some of the metals and everything. But, always put it, use cold water, but let it just flow, for a couple minutes. And then you can use that water, cook with cold water, use cold water, not hot water. But so having a filter container, that would be good. Filter your water, but also let the water run for a couple minutes in the mornings.
Those
Yeah.
are good suggestions. Thank you so much.
Yeah.
We have a couple, I don't think we have any more questions. Does anyone have any questions? I'm gonna close out the recording and then we can shift our discussion to Alliance announcements and next steps.
Well, I encourage you. I look forward in meeting you all and hearing back from you if you whatever specific questions or collaborations that we can do together in the future. And thank you again, Angela, for all of this. Angela, quick question: do you want me to? Should I leave the meeting then overall?